Good afternoon. We're into the Thursday. We're heading towards the end of that 2-week period. I said when we are seeing the impact of the majority of the people returning to Canada following various trips, etc., and we're seeing how that's reflected in those who might have inadvertently picked up the coronavirus in their travels and having incubated it, and we're now seeing positive laboratory testing. So we're seeing the impact of that this week. So we'll talk about that in a moment. And how's that rendering itself? What are we seeing? How is our lab testing keeping up with that and other issues there? We're concerned, of course, with our ongoing aspects with changing the directions with outbreaks in long-term care facilities, and how we were going to be looking at some aspects with modeling, I believe, tomorrow. There'll be some announcement on that one there, and I'll talk about that in a moment, as well as what should we expect in the week coming ahead as far as their data and what we're going to look at as far as how well we're doing with our physical distancing and our social public health measures in that regard. So before I go into that, I'm going to ask Dr. Yaffe to talk about the data points, the important ones for today. So over to you, Dr. Yaffe.
Thank you. So the data as of 4 p.m. yesterday, that's in the Integrated Public Health Information System, IFIS, where public health units input the data. We have a total of 2,793 confirmed cases of COVID-19 in Ontario. This is an increase of 401 cases compared with the previous report. We have, at this point, data on 53 lab-confirmed cases that have unfortunately passed away, and we're aware of at least 26 outbreaks in long-term care facilities, with 19 deaths related to those outbreaks, some of which were lab-confirmed, others are just epidemiologically linked. We're aware as well of about 8 outbreaks in retirement homes. We know that this is an underrepresentation of the numbers. As I indicated yesterday, we do continue to work very hard to ensure that our systems are as up-to-date as possible so that we can provide as current information as possible. We do continue to see an increase in the number of resolved cases. We're now at 831 resolved cases in Ontario. We have 405 patients with COVID-19 currently in hospital. Of those, 167 are in intensive care unit, and of those 167, 112 are on ventilators. In terms of the lab testing, we have the labs, that's Public Health Ontario, and other labs that have sent their reports into Public Health Ontario have tested 4,859 people over the last 24 hours. The number under investigation has gone down to 2,052, which is good news. Thank you.
And thank you. And one aspect I know that some have been looking at and trying to do some comparisons between one province and another, and I would ask that you do that cautiously, simply because our provinces are quite different from each other. COVID-19 doesn't impact each province at the same time in the same way. And I've been emphasizing all along this is a pan-Canadian approach, and that we are trying to do each on our own aspects there, and while some may surge above the other and below the other. And so if you're comparing numbers and aspects, you have to understand if it's population basis, that includes not only the populations, your number of various work groups, etc. Ontario, of course, with a population of 14 million, is quite different than a population size in Quebec and different than a population size in British Columbia. And if you put those over the population, look at the rates, you would get a better sense of how it's doing on an overall population rate. Nevertheless, just because your rate may be low because you have a large population doesn't mean you can take solace that your numbers are not that important. The numbers are important. The deaths are important regardless. So I just ask the caution on numbers and interpretation and how that's done. And we've had a lot of questions on that. And as always at these times, data, its interpretation, how it's acquired, the mistakes in doing that, etc. I don't want to sound like it's answers to that, but it is complicated. As I always remember in one of my courses on surveillance, they asked me to do a 20-page essay on all the errors and asking someone their age. And I thought that was ridiculous, but I ran out of room after 25 pages. So it is complicated, and the errors are there, and you have to address those and ensure that your data is there, it's clean, it means what it's supposed to mean, and you have to understand there's a number of errors that are made often in putting that data in by many different partners, and the more people you have involved in that, the more complicated it is. That's not an excuse to say we shouldn't have good data, and we are working hard at that to make sure that we can inform you, the citizens of Ontario, how are we doing in this approach, and with the best data and most accurate we can give you at that time, because that tells you how, as a province, collectively we're doing, and what we have to put emphasis and directions on in the future. As I said yesterday, our command table is made up of many groups, many areas, and many aspects that are looking at all the components and doing the various aspects of the data collection, the analytics, that gives us the metrics to say what's working well, what's not working well, what do we have to work harder at. So that's one of the important things I wanted to talk about today in that. At the same time, we're looking at our diligently with our long-term care issue in there. As you noted, both in Canada, with we have ours, as Dr. Yaffe said, how many outbreaks we have. And my sense is that with the change in directive I've given to the long-term care facilities, the number of outbreaks will hopefully, and this sounds like counterintuitive, go up. Why? Because our trigger point is very sensitive. Any mild symptom in any resident is automatically an outbreak declared, and all the steps are taking place. That's not how we do it with influenza, but we've upped the ante on this one in the long-term care facilities. As I said yesterday, we're probably going to have more outbreaks reported quicker, but we may have a lot more quickly diffused after we do the more direct testing, and they're saying, okay, false alarm. As I said yesterday, I would rather have false alarms and rather not hear about them in general. So these things will change, and it'll look like a delta change in the overall data, but it means we've changed the perspective and how we record and monitor that. And we're working continuously with our Ministry of Long-Term Care on how we might assist and work with the whole sector in that. We're working hard with Seniors Ministry on with retirement homes as a new group there, and our other vulnerable population groups with many different groups and sectors working at different tables to give direction, guidance, and then what are the ongoing metrics and measurements we need to do to say, is this sector being impacted, yes or no? Are interventions working, yes or no? And how are we doing with those? So I want to conclude with saying this week, as I said, was an important one. You heard from Dr. Yaffe our number of cases. It's down a little bit. It's staying those numbers there because this is what we're seeing from about a week and a half to 2 weeks ago when we had the major number of people coming back into Canada during that week of the 16th of March going into the weekend. And so we were going to watch to see what happens now after that's over with the number of travelers dropping. We're seeing already the number of cases reported percent-wide of people with a history of travel is dropping down. That's to be expected. Then how are our public health measures? What is that data going to look like next week? And we're going to hear about that. And as I said, I heard already that there are going to be some discussions tomorrow with modeling and some aspects put forward because there has been a sense or desire to say, what's the forecast? What do you think we might be expecting? And what's coming down the road? Being aware, of course, that when we're looking at modeling and that, when we're talking about the impact of these numbers we saw this week with the number of cases being reported, those ones, there's a delay then in the impact on our healthcare system because those ones get assessed in our assessment centers. Some of them, 6% about, and will end up getting an exacerbation of their illness and getting hospitalized. And 2% of those may actually get sick enough to go in ICU. And there's even a smaller percentage that unfortunately may be deceased in the future. But the thing is that there's a further delay because we find the average time when someone's admitted to ICU and on a ventilator is a prolonged period, almost like 10 to 10, 12 or 13, 14 days. So that is going to be extrapolated over time and to see the impact of that. So I'm just trying to get you a sense of the timing of these things and what you would expect to see in the data on a go-forward basis into early next week and in the middle of next week. So with that, I'm going to open up for questions and for both Dr. Yaffe and myself.
Okay, we'll take questions from the first caller.
Your first question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, Dr. Williams. We heard the Premier this afternoon describe the numbers and modeling that we're going to see tomorrow as hard to hear and a wake-up call. I'm wondering, as somebody who's obviously quite familiar with the numbers, how would you characterize what we're going to be learning?
Well, I think, I'm going to be waiting until our experts get to be involved in the announcement. We've had our scientists working hard at doing the modeling. We've worked hard with them even late in the night last night to get more data over to them because, as I said yesterday, when you're doing the modeling and you're looking at, the term was an exponential or logarithmic scale, those very small part of the beginning, little deviations make a big difference on the projections. Therefore, the more data we can give them, the more able they are to make some better projections and forecasts in that sense. My point always with those kind of things, they give us an idea of what we should prepare for. I really feel that by what we're doing, we can still bend the curve. We're doing that. I think we can achieve that. And they'll say that probably in the modeling. If you do this better and better and better, you will potentially shift the forecast. But right now, they'd say, here's what it's going to look like. So I think the numbers, as always, will be challenging as people see what might progress as some case scenario, as middle case scenario, and as worst case scenario. I think people have to understand that because it's feeling that if people see what might be possible, could be possible, and what we might achieve through our ongoing energy and efforts of public health measures, physical distancing, it means we need to stay at the task and to do our part to flatten the curve and impact that and change that projection as best we can. So I want everybody to wait until we get some of those numbers and aspects put out tomorrow.
Follow up?
And correct me if I'm wrong, but it looks like the percentage of cases who have been hospitalized continues to go up, at least over the past few days when we've seen that number. Is that right? And how important is that metric?
I have not calculated the percentage, but I think it's important to realize that now that the lab capacity is starting to improve, which is great, the prioritization of the testing has been on patients who are hospitalized, among other groups. So, of course, by definition, the percentage that are hospitalized would be going up by the fact that they are being prioritized for testing, if you follow me. But obviously, it's of concern that some of the people are serious enough to be hospitalized, and that's something that needs to be considered in the planning.
Next question.
Your next question comes from Christina Tenelia with CP24. Please go ahead.
Hi, doctors. I know a lot of the questions you're going to get today are surrounding the modeling and the numbers we're going to see tomorrow, which, of course, you're well aware, Premier Ford described as being stark. So on March 11th, the federal health minister, Patty Hajdu, said as few as 30% of Canadians and as many as 70% might be infected with the coronavirus. And that would cover anywhere from 11 million to 26 million people in the population. Since then, we don't really have an idea as to what the numbers are now. I guess what I'm wondering is here provincially, how accurate will these numbers be tomorrow? I know you've already touched on this a little bit because the Prime Minister has been saying he's not releasing these numbers because when they have accurate numbers, they will. What can you give us in terms of where the province is right now ahead of tomorrow's announcement?
Well, if you're looking at the numbers, as you can see with our total for Ontario with 2,793 confirmed cases out of a population of 14 million, you can see that's nowhere near 70%. And so, okay, that's where we are right now. They're saying over a 2-year period, you may get up to 70% on a theoretical model on that, assuming that you haven't done any measures to try and flatten or Dr. Tam's term, plank the curve. You'll see that like South Korea, their overall infection rate or positivity rate for their population writ large is nowhere near 70% in that, and very few have got to that level thus far. But most are saying you have to look at this over a 2-year period, not just over 3 to 6 months. So, so where are we? In the aspect here in the very early days, I think our numbers are still relatively low compared to some other countries in there. Again, I don't take solace in that. We have been doing a great work at doing our physical distancing. I think Ontarians are doing a great job at that. We're ramping up our case contact management, our containment. And so I think by some other calculations, we might have been easily up at 5,000 to 10,000 cases already, but we're not yet. But as I said before, doesn't mean we can rest on our laurels in that. We have to drive assertively, continue to keep that down, especially as I've been telling Ontarians this week, and how the coming to the next week is very important to watch that to see how effective we have done, and to keep us planking or plateauing down at a lower number will be important to see. So we're not anywhere near those numbers, but we're not saying that yet that we have won that one yet. We're still pressing hard and to see if the data, as the Prime Minister said, modeling is forecasting. The data tells you the reality. And what's the difference in how they compare the two? Much like a forecast of a large blizzard versus what actually fell on the ground and how you handled it are two different things. You should prepare if there's going to be a big blizzard. You shouldn't be foolish. You shouldn't go out and driving. And if it isn't as bad as it is, okay, because you may have taken safety precautions and that. But at the same time, what actually happened in the event and what was the actual accumulation, et cetera. That's what I think they're trying to allude to. And there's always that balance between what does the data tell you, how does that fit with the modeling, and how does each one inform the other.
The information we're going to receive from you tomorrow, as per Premier Ford, you said modeling is the forecasting, data is the reality. Premier Ford used the word data, so we'll be getting the reality?
We're telling you the reality today. We're giving you the data today. That's what we do every day. We say this is how many were yesterday, because it's never up to the moment. As we said, some of the lab tests and different things. So the most current up-to-date data is what we tell you each day, so you're informed as to, for example, in the weather thing, how much snow fell yesterday and this kind of stuff there, the same type of thing. So we tell you the data, and if we don't have the data, we go looking for other data points. And so that's what the modeling would say. If there's, and we're always asking ourselves, we have groups looking at the data and the quality of it, timeliness of it, the cleanliness of it, etc., and other points we should be collecting that inform us better. So we have the data daily, and we update that as best we can and keep that current. The forecasting is saying, are we on this track or that track, or are we achieving successes in different areas? And so it's a metric of how we measure ourselves and look at that. So I agree with the Premier. We have the data now, and we're going to keep doing that and keep informing the Premier what the data is. And then he wants to be informed by what does the forecasting look like so they can do the adequate planning. We as the command table do the adequate planning for the resources. If it is worst case scenario, moderate, and light scenario, we always have to plan, if we can, for the worst case scenario, because you don't want to be unprepared in this manner.
Next question.
Your next question comes from Travis Daharaj with Global News. Please go ahead.
Dr. Williams, what is the worst case scenario?
I guess we're going to hear from the modelers. I've had some reports, and they're doing some more, and they're revising it yet again. So I haven't seen their final one yet in there. How much they're going to project on that will be interesting to see what they have to say. As I said, we were just asked to give more definitive data, even some more last night, as they tell to retool and refine that. So I think we'll hear that tomorrow.
Okay. Are you, from everything that we're hearing, these numbers are going to be pretty bad tomorrow. Are you recommending to the Premier stricter measures, such as shutting down construction sites? I know that there may have been some discussions about travel bans, et cetera, even within the province, and restricting travel within the province. What else have you recommended in terms of strengthening up some of these measures?
Well, we're in continued discussion with the Cabinet and with the Premier and the Minister of Health on those aspects there. I'll give recommendations, and I think there's discussions taking place at this time and being considered, so I really can't talk about those at the moment, but I've always found that my recommendations are accepted as being valued input for them as they do the mixed decision making and come up with the best advice at this time to respond and to continue our public health measures and our attempt to continue working at flattening the curve.
Next question.
Your next question comes from Kenyon Wallace with the Toronto Star. Please go ahead.
Hi. We've been seeing data from the Critical Care Services of Ontario that goes out to hospitals every day. Some members of the media have gotten this, and it's been showing that in hospitals across Ontario, the capacity for critically ill people is slowly decreasing as we progress in this pandemic. And one of the areas the Central West LHIN is already at its ventilator capacity. So what is being done to get more ventilators into hospitals across Ontario?
Okay. When you ask about that, because you remember the demand on ventilators, while the added burden of COVID is there, there's all the time, day to day, demands on ventilators for other things. And so even before we came to this phase, ventilators, for the most part, were a very highly used percentage anyways, because sometimes even people on elective procedures have to have a period of time post-operatively on ventilators. So that's a normal demand. We've increased some capacity there by canceling elective surgery, but that doesn't preclude that other health conditions are continually presenting to our hospitals that require ventilation due to non-COVID reasons. So as to what percent of that makes up the Central East LHIN, or maybe just that they have a stream of other things coming in that demand ventilators, this is part of all the surging and moving around. We do this during normal flu season. We have some issues that have to deal with that capacity issue. I think as far as the equipment, we continually looking at more in the stockpile, purchasing more. We have companies that are ramping up quickly in the production of it, as the Premier has alluded to. So we have a lot of people coming forward with great suggestions and aspects, because everybody's competing for the same resource globally, but it looks like we have some potential ideas to do some aspects here made in Ontario, if I can use that phrase.
Follow-up?
Yeah, you alluded to some stockpiling, and the numbers I have from the province are that there's approximately 210 ventilators that are currently stockpiled, and another 300 that have been procured, but I don't think they're in the government's hands yet. For those 210, do you know, are they inside hospitals yet, or do they kind of get sent out when hospitals need them or ask for them?
There's various ways it's done in our protocol. We may send them out to some of our more central ones that would have a greater capacity, because if you have a ventilator, extra ventilators, you have to have the extra facility and rooms to put them in, and the extra staff or potential staff to ramp up and to take care of those, including various specialists, whether it's respiratory technicians or anesthetists and other ones that would be able to assist in that process. So you want to go and give them to the organizations that have the greatest surge capacity to add. All of a sudden, you're going to double your ventilator capacity. You have to have more than just the ventilators. You need other things in place to do so.
Next question.
Your next question comes from Althea Raj with HuffPost Canada. Please go ahead.
Sorry, I had to unmute myself there. My question is about asymptomatic carriers. The CDC has come out this week and said they believe that as many as 25% of coronavirus carriers could be asymptomatic. Do you believe that the percentage is that high? Or what's your assessment of the situation?
Well, I'm aware of that. Right now, what we are certainly, we go with the advice from Public Health Ontario and the Public Health Agency of Canada. And so when we get a case reported, we now assume that the person could have been infectious for 48 hours prior to the onset of their symptoms. And in terms of then contact follow-up, who might they have been exposed to? But in terms of asymptomatic, we at this point do not have a clear data from Ontario in terms of that. But I think if you think about it, social distancing or physical distancing is really assuming that anybody could be infectious out there, and so that is one of the big rationales for why we want people to stay home, and if they are going out, to stay at least 2 meters away from other people, because it is possible they're asymptomatic and infectious. So we don't want people to be infected by other people, even if they're not sure if they're asymptomatic. But that's something we keep looking at with the science with Public Health Ontario.
Follow-up?
So if that's the case, then should the advice about, at the moment, I think the Ontario website says, go out for groceries once a week. Should we be masking up and putting on gloves? Like, if we think that we might be an asymptomatic carrier, or that's what the message is from public health officials, what precautions should we be taking when we do go out for essential reasons?
Well, I mean, obviously, don't go out if you feel you have symptoms. That's the first thing. And if you go out, stay at least 2 meters away from other people. And one of the things we have heard about is that people are going out with their family to go shopping, and it's important to go out. Only one person should be going out grocery shopping, ideally once a week, so to minimize any potential exposures. But we are not recommending people wear masks or gloves at this point who are going grocery shopping.
And remember, wash your hands or use your hand sanitizer.
Next question.
Question comes from Phil Perkins with CHCH. Please go ahead.
Hi there, doctors. We're seeing that the number of tests that are under investigation are going down. I believe it's under 3,000 now. Is there a chance that once those are wiped out, that perhaps there's a chance that we can start testing everybody, not just people who have symptoms, just as we said weeks ago, just to make sure that everybody's covered?
Well, everybody is 14 million people, and I'm not sure we're up to that capacity. I think it's important to focus still on people who are symptomatic or who have been contacts who develop symptoms, and there are certainly people who are fit those categories that are not being tested at this point. So I think that those would be the groups.
Follow-up?
And hearing from the Premier, he's using words like stark. He doesn't want to create panic, but I'm speaking with others. They're a little worried about tomorrow's presser. But hearing from you two, you seem to be measured and calm. Why is that?
Well, measured and calm. I think if you think we're here sort of laid back, we're not. We have concerns all along. We've been saying this concern for quite a while. We know what some of these projections can do. We've seen what's happened in the other countries. That's why we pulled out the pandemic plan from day one. That's why we've implemented the command table. That's why we are concerned with the healthcare system ramping itself in a situation to take on the potential load of the cases, why we're doing as much testing as we can do. This is all part of our concerns over the potential impact it may have on our country. This started back in the end of January. So this is not new to us. These numbers we're seeing here and the forecasting are basically ratifying some of our concerns we've had in that matter there. What we want to know is that the hard one, the steps we're taking, can we impact that? We think there's going to be some commentary that we have impacted it, and probably if we continue to do more and keep at it, we can impact it further. That's more important for us to say, rather than saying, it's coming, there's nothing you can do about it. We don't accept that. We accept that by doing everything we are doing, we're going to impact it. We're going to make changes. And that's why we've been talking to our public here in Ontario day in and day out, asking them to not have the children go to school, to stay home, to do all the things that Dr. Yaffe just alluded to continue to stay the course. Because it's not something that happens just one day. We have to hold this for a while. And you've heard some talk about even a longer period of time to hope to curtail that way. And so I think concerted, strong energy in that way, that's what we believe as public health officials. That's why we do the contact case management. That's why we do the public health measures. All these things are critically important. Why? Because we know what the numbers could look like.
Next question.
Your next question comes from Chris Glover with CBC News. Please go ahead.
Hi, guys. Thanks for taking our questions. Today, the Chief Science Advisor of Canada was critical of Ontario's testing regime. You already talked a little bit about how many cases you still have under investigation, but she was saying that she's preoccupied with the backlog of tests in Ontario and thinks we need to ramp that up. Can you just touch on how big the backlog is here, defend why it's so big, and what you're doing to fix it?
Well, as Dr. Yaffe said, the backlog that we have now in our central laboratory is down nearly under 2,000, and that's their capacity each day. So it means, in one sense, if they expect a full load to come in with new tests, 1,900 is like their normal operating aspect there. So we pretty well have worked that out. Our labs outside of the PHOL have no backlog, and they continue, but they will get tests that come in during the day that still have to be processed. Is that a backlog? That's just the normal processing of laboratory tests. So I think in that way we have achieved that, and so there's no tests sitting around there for 4 or 5 days. We're up to the day before and handling that load in that way. And so I'm not sure what the ongoing concern with the backlog in that regard is. Part of the reason that we're having some of our increased numbers is that the Public Health Laboratory in Toronto here, having worked diligently to get that backlog off, you're seeing some delay of a few days in there, and we want to know how much is that impacting our daily numbers, and we'll get a better idea of that. Now we're down to there with the backlog pretty well gone. What does that look like over tomorrow and into the weekend? May give us a truer sense of live time, what's going on day by day, reflecting back 2 weeks ago. So we were concerned about it. We're working on it, and we said we would bring it down this week, and we've done that.
Okay, unfortunately, we're running out of time, so this follow-up will be the last question.
Okay, so another thing that's already been touched on a little bit is the shortage of ICU beds. The last that I had heard was that stats show there's roughly 400 ICU beds that remain available in the province. Just curious, is that still the figure that you guys are working with, and how what's being done to try to make sure that we have more ICU beds, as we know that more people are going to need them with this virus?
So, I mean, right now, it says we had, Dr. Yaffe said we have 167 in the ICU that have some relationship to COVID-19. That's out of a total of almost 3,000 beds in ICU beds in the province. So, as I said before, not that those beds are sitting empty. They're there with other patients who have come in. Some are still having some procedures done and need to have some ventilation. So we don't want to halt everything in that regard. So the capacity is dependent on two things: how many more of COVID patients will be coming in, combined with how many people are there and coming in for other causes and reasons, because life goes on, unfortunately. And people have health complications, sometimes accidental ones, and they have to be dealt with. We do not ignore those ones. And so the capacity of patients and beds is not just an aspect of COVID patients only.
Okay, thanks very much, everyone.